The show today brought to you by the Academy of Orthopedic Physical Therapy, the leaders in orthopedic physical therapy. Find them online at orthopt.org. Now, with their current concepts of physical therapy in their 5th edition, it can help you prepare for that OCS examination. Find them online at orthopt.org. The Brooks Institute of Higher Learning gives you advanced post-professional education with 7 on-site PT residencies, including orthopedics, women's health, pediatrics, sports, and neurology, as well as an OMPT fellowship, all focused on experiential learning. Find out more at brooksihl.org.
But change is hard. Even in the most innovative companies, change is not easy. And so how you present that effectiveness, how you communicate that effectiveness, and match that with the efficiency that we're going for is really paramount. And so really being the face and not only just about being a face, but showing and working and building relationships based on trust really help make that easier.
Today on the show, we're diving deep into the world of healthcare innovation and physical therapy with someone who's been redefining how we approach patient care at scale. He spent over a decade pushing the boundaries of what's possible in PT and athletic training, from college sports to large healthcare systems. Whether it's tackling inefficiencies head on or creating hybrid care models that challenge the status quo, his passion for empowering patients and clinicians alike shines through in everything he does. He's the kind of person who sees a problem and asks, how can we do it better? And then he gets to work making it happen. Today, we'll hear about his journey, his role in bringing the innovative MoviHealth platform to life, and why he believes physical therapy is at the forefront of healthcare's future. Oh, and did I mention he's also a husband, father, coffee aficionado, outdoor enthusiast, and always up for a good challenge. On the show today, Stephen Clark, Clinical Innovations Director at Confluent Health. Stay tuned. This is PT Pintcast. Well, Stephen, welcome to the podcast, man.
Yeah, thanks for having me on, Jimmy. Pleasure to be here.
I like to start with something not necessarily on topic, but like topic adjacent. So first off, your mom was a PT, licensed PT, 30 years before you. How did that shape your view of the profession growing up? And maybe how does it influence the way you sort of innovate in physical therapy today? Good family connection.
Yeah, exactly right. So my mom was a PT. She was a bachelor's level PT. She graduated from Georgia State. So when I was coming through undergrad, was interested in PT for sure. Actually went up to Georgia State. She got me the inroads. I chose not to go there, but yeah, my mom charted my course in physical therapy really. And the way that played a role as a child is I always was amazed that whenever anything was going on with me or something hurt, she knew exactly what to do to help. Now, as a PT here in 2024, after being a PT for 10 plus years, I recognize that's probably more influential of her being a mom rather than a PT, but certainly helpful as well. And so the way that really helps in how I innovate is having fast access to a physical therapist, and being my mom really did pave pathways for me to get better and do things, have things taken care of quickly. So I really think that when I think about innovation and physical therapy and how we get better access to patients, it's really about that quick ability to see a PT. And that's what I had as a kid. That's what I had all throughout, growing up and even today.
Now these parallels, was she guiding you to being a PT, or was she just sort of motivationally interviewing you to go wherever you wanted to go?
Yeah, that's it for sure. Yeah, I don't even remember really that she ever was like, you should be a PT. That was never really a pressure that I felt. She was my mom, so I looked up to her. Saw what she did every day. When we were younger, we would get to go into the clinic with her and see her working on patients. So when we were really young, she would work in places that she could care for us, but also have a job where, she could provide for our family. Alongside my dad. So my dad was really the breadwinner. He was the one that was making money, but mom was helping. And so we would go into skilled nursing facilities with her at times, and she would be seeing patients. And when you walk in the front door, and everybody knows a physical therapist. And so, there was this rah-rah of who Tracy is and her kids. And then we got to go into the clinic when we were older. And then I had a shoulder injury in high school and actually was able to rehab with some of her coworkers. And so really influential just in my life and being around it. Really like the camaraderie and the atmosphere, and just really seeing people going from some of the depths of what they had going on in case of a stroke or even musculoskeletal injury to being better. And my mom did a really good job of keeping that relationally focused. And so that was a huge opportunity that I saw to really leverage, the skill that she had as a physical therapist, but also the kindness that she had just as a person to develop those relationships. So
yeah. And before we get into your role at Confluent, because I think it's pretty unique, that's why I reached out. Before we get to what you do now, you've already worked across diverse settings, college athletics, startups, large practices.
yeah.
How have those experiences shaped your approach to problem solving and innovation at Confluent? We'll get into what you get to do now.
Sure. Yeah. I think a lot of the reason that I am where I am is because I've done different things. And those different lenses is really what helps guide you into understanding how you can solve problems. And so if we get, so narrowly focused or only in view of what we see or what we have seen, it really restricts what the opportunities are for innovation and improvement. And so, being in college athletics and seeing direct access, we didn't have to worry about referrals. Athlete goes down, you help them. In small practices or startups, you're gritty. You got to get stuff done. You worry about things a lot less down the road when you have somebody in front of you that you can help, and you just go do that. Big practices, you develop an acumen for business and developing priorities and making sure you're keeping your eyes on the right thing and making sure your impact is in the right place. And so when you combine all those things together, you really get a much more broad view of how problems can be handled. And I think that goes outside of the PT profession too. I think one thing that we would do ourselves a favor in is adapting and understanding what goes on outside of our very narrow focused in PT, as broad as that is, right? PT is a great profession.
Broad.
So much you can do. I saw this past week you mentioned on LinkedIn, I think, just neuro-based PT. Like even in that, there's so much. There's so much in musculoskeletal space. Just what a profession, man! You have so many options, so many opportunities. But still, we gotta be more broad and think outside of what our narrow lane is.
Well, your job title, your official job title, right? The one that you put on the resume, says Clinical Innovations Director at Confluent Health. What's that mean? Because again, like LinkedIn will sort of suggest job titles because it wants to sort of be able to track us across. Like these are all directors of rehab. These are all VPs of whatever. But sometimes a job title innovates itself. So what do you get to do? What's your job like? And don't tell me it's different every day. Everybody's job is different every day. But what's your job title mean to you, or how do you describe it at a dinner party?
Yeah, it really is different every day, but I won't give you that as the cheap answer. I will say also that when this was the job title that I was really applying for and being teed up for, Clinical Innovations Director isn't something that pops up as a catchphrase on LinkedIn or Indeed or any of those. So it is sort of unique in that what I get to do every day is be the PT subject matter expert on any of the innovations that we're building or designing or deploying. And so I get to be the PT in the room when there's a tech guy and a business guy and a product lead and all sorts of people working together to come to a solution. I really get to be the PT subject matter expertise. So, designing from the ground up, implementing and informing how people build systems and processes within, and really being the face of what we're designing in terms of how we're going to impact our patients, how we're going to impact our PTs and support our therapists, PTs and OTs. And so really an exciting role, a role that changes, but in a lot of ways, it's really focused on the very basics of providing the best service we can to our patients, but also to our entire business, including our physical therapists and our front office and the people that support the PTs as well.
Now, I'm a little bit of a dork because I have a favorite type of diagram. I don't know how many people out there. Mine's a Venn diagram. I just like the simplicity. And you're sort of highlighting where you get to sort of have this innovations, which is still like, I feel like it's a buzzword in the last 3 or 4 years, right? We've always want to be innovative, right? but you get to sort of cross, like, your job or your role is to, how do I make this thing, when a business or IT person says we're going to implement this technology, we're going to add AI to some part of our business, you get to come in with that second circle and say, great, how's this going to touch our clinicians? How's this going to help them affect change with our patients? My mom put it, because mine was communications and innovation, right? In terms of clinic. And she just said it simply, oh, I get it. You speak both languages. So you get to translate for one side and the other. And I said, see, you explained it best. Moms just always know the way.
That's right. Yeah, that Venn diagram really in my role where I see it is exactly that, right? Like translating the language from, a tech consultant that's trying to build this very specific thing for our purposes to the PT side of it as well, but also really the intersection of effectiveness and efficiency, right? Because if you're efficient but you're not effective, or you're effective but you're not efficient, so it's really trying to figure out how you blend those together with all of the challenges that come with using new software and some of the archaic systems that we as a PT profession use, which none of us are. That's not lost on any of us, but change is hard, right?
Sure.
Even in the most innovative companies, change is not easy, and so how you present that effectiveness, how you communicate that effectiveness, and match that with the efficiency that we're going for is really paramount. And so really being the face, and not only just about being a face, but showing and working and building relationships based on trust really help make that easier.
Whether it's technology or clinical care, the strength and difficulty is at the beginning and end, it's people. People are messy, right?
Okay.
But we want people to be messy, because that's what makes people. But you still need to be effective. And you've actually said that you see inefficiencies as opportunities for improvement. Like, walk us through a challenge you faced at Confluent Health and how you turned that into a successful innovation. Because if there's not a pain point, you really can't be innovative, or it's harder, I should say, to be innovative there. So what's a situation that you took that pain point of inefficiency and brought something successful out of it?
If you work in outpatient PT, you interact with your EMR a lot. You deserve to have an experience that's seamless and integrates all the things you might need to do, like a patient portal, marketing automations, and billing, all in one, all at an unbeatable value. That's what MW Therapy does. Switching over is a breeze. Take a test drive right now and see what you could do with them at mwtherapy.com. And where's your PT career license taking you? Get a driver's license, you can drive wherever you want. If you're a physical therapist with a license, you can provide physical therapy wherever you want. That's what Jackson Therapy Partners is there to do. Extraordinary patient care adventures with Jackson Therapy Partners. Perfect for PTs eager to make their mark. Do what you want to do, where you want to do it. See where your skills can take you at jacksontherapy.com. And if you've heard about this thing, we've had it on the show before. It's called remote therapeutic monitoring. And it could boost your clinic's revenue and help more people. Those two things are good. Find out how Physiotech can help you do that. That is Physiotech at their website, physiotech.ca. That's physiotech.ca. Maybe boost your clinic's revenue by $290 per patient per quarter now with Physiotech.
Yeah, so I'll talk about one that we recently did, and this is helpful because we'll be able to draw from people that have been in the industry, since COVID at least, and understanding that virtual care became this thing overnight, and then people abandoned it pretty quickly on the other side of it. Some people took it up and made entire business models off of it. But also we're at a place in physical therapy where we understand that access is hard to come by. We have a shortage of PTs, at least in the outpatient musculoskeletal space. Larry Benz has been hugely effective at showing us how and where and what those numbers are. And so when you hit the intersection of, that patient access is critically important to the outcome of our patients, right? When we can get them in early, we can be a whole lot more effective. But you have wait lists that don't allow that threshold of early to happen. How can we be effective at getting that patient in, or at least on the right pathway so that they can get in? So what we did at one of our partner clinics was provided a virtual evaluation to any patient that wanted to take us up on it. They were Medicare patients. So we thought, who could we prove this with that would be pretty applicable across the board? So who's the hardest person to get to adopt virtual care, right? So Medicare was the one that came out, right? There's restriction in payer rules that reduce their access. The clinics are busy. We don't have enough PTs to service the people that want to come in. These people aren't generally going to want virtual care. At least that's what we tell ourselves. The truth is the age gets older and older, right? The ability for a patient to manage a virtual environment gets better and better every year.
Right.
It does. Patient gets older every year, right? So let's go prove it with them. Let's go see how this works. And what we were told from the outset is, fine, you can eval them, but when they come into the clinic, the PT is going to have to do another evaluation. The patient is not going to be real thrilled about having to see somebody different. And are you really changing any of the problems that we have? They're like, well, let's just try it and see what happens. And so we did. We offered every single Medicare patient a virtual visit.
Wow.
And we had patients that took us up on it. And what we found on the other side is that patients loved it because they knew they were where they needed to be. Jimmy's got a shoulder problem. I don't need to go see ortho. I really just need to start working on this thing. And here's a couple of things that I can be doing in the interim that when I finally get in the clinic to see Dr. Nelson, my shoulder is going to be on the way, and then he's going to be able to help me the rest of the way, right? So they're on the right pathway and they're confident about their pathway. We then found that the virtual evaluating therapists, when they speak the same language, and we make an intentional effort to offload the therapist and do a really good job of relationship, what we call relationship-based care, right? We're giving that PT in the clinic some information about who this patient is more than just their shoulder. So we call it a relationship nugget.
Sure.
Right? What do I need to know about Jimmy when I pick up this patient? I've never seen him before, that I can crack a joke at the beginning of the episode, right? The only way that the patient or that the in-clinic therapist would have known that is if they had a conversation or communicated with, whether that's synchronously or asynchronously, with the therapist that evaluated them. And you're talking about, you're hitting on therapeutic alliance right now. And when we have a strong therapeutic alliance and we get to our patients quickly, I like those odds. And we're starting to make change quickly. So what we found was the therapists absolutely loved it. They didn't have to do the evaluation documentation. They had the basic outline. We made quick snippets. We call it a 2-minute drill. They knew what we did, what we were proposing as the hypothesis for their treatment. And then what we weren't able to evaluate in a virtual environment, they might want to look at, right? So I can't hit DTR, but I can suggest somebody does if I think that needs to be done. And so we found that therapists loved it because they didn't have to do the documentation and they were a leg up. They could get in and treat the patients. That's exactly what we as PTs want to do. We want to treat our patients. And so patients loved it. They were a step ahead. They were where they knew where they needed to be. And then the patients that weren't appropriate for care got to where they needed to get, right? And it didn't bog down the clinic with another eval that didn't necessarily need to be seen in the clinic. And so, you really start getting at the triple aim there, right? There's some cost efficiencies in there. There's a ton of patient benefit that's in there. There's provider benefit in there. And then it's outcome bearing, right? We've got that therapeutic alliance. We've got those things built in that the patient has fast access to.
So you open the door there for this idea of a team, because you said it might not be the same person providing the virtual evaluation versus the person they see in clinic. That person might be somewhere far across the country, but they were the first person available. So what does it take to truly foster an innovative team in healthcare? Because while it excites some, everybody wants different, but not everybody wants change, right? Different's nice, different's fun, but change can sometimes be scary. But to get it to work, or to figure out if it's going to work, you've got to get that team to truly try this and to truly buy in. So how do you get that buy-in? How do you keep that momentum?
Yeah, the team-based approach really is based on, it's got to be built off of trust. So we know team building principles. We know how important it is for the collaboration of whether it's within the same team, right? So a bunch of PTs coming together to talk about a patient or to manage a patient together, what we call hybrid care. We don't do handoffs. We co-manage. We work together. It's an extra set of ears. Or we're in some integrated care environment, right? So I did some work with Walmart Health alongside Walmart Health, which was super exciting, right? We were able to sit down and have conversations and build trust provider to provider to understand how I might be able to leverage that primary care doctor much more effectively, how they might be able to leverage my set of expertise and skill set. And sometimes that looks like very specifically talking through patient cases, but sometimes that's the confidence to know that I can just hand this off, right? So, in Walmart, we saw lots of opportunities with uncontrolled hypertension, and we saw lots of just primary care needs that were just unmet. And when I can send them next door and I know that they're going to be cared for and I know that they're going to be managed, and then I can follow up on that, it provides a whole nother opportunity, and it changes the lens in which I see that and manage that patient. So now we can talk about lifestyle intervention. Now that your blood pressure is controlled, we can work on cardiovascular exercise that's going to make a huge long-term impact in how you manage your shoulder pain and your back pain. And so trust is really the groundwork that everything else is built upon. And then ongoing relationship really helps that, because when you come in as a patient and you see Steven as your physical therapist and you see your primary care, and they're referencing each other and talking to each other and they're all on the same page, that's really what integration and integrated care is about, is making sure that patient's needs are met with the trust of the providers that are working it together. And excitingly, there's a lot of that going on in healthcare today.
I imagine finding the right people helps, right?
Hugely important.
Yeah.
Because if I'm the PT and I should see everything and nobody's expertise matters, then so humility is huge, right? And the primary care's provider's ability to say, hey, I noticed this thing. Did you check that? Is not going to happen if Steven's arrogant and doesn't want to hear anything about anybody else has to say about anything musculoskeletal, because I'm the PT and I know everything there is to know, right? So so humility is huge in that as well.
The right person. MoviHealth, revolutionizing virtual and in-person musculoskeletal care, an innovative way to get back to the things you love whenever and wherever you need it. I'm reading the website from MoviHealth, which is movimsk.com. Like, it's live, it's out there. What is it? How would you explain it? Because I think a lot of these things are similar but not the same popping up. How would you explain what you guys are doing with MoviHealth?
Yes, so it really depends on if I'm talking to a table full of PTs, which is likely this conversation, or if I'm talking to a patient. And so if I'm talking to a patient, we're talking a lot more about how effective getting to a PT quickly is, right? What is the diagnostic accuracy of a PT and how that measures up against who they might go to see instead. So that's really the lane that we talk to about in patients, is how effective physical therapists can be, how much money it can save them, how much trouble it can save them, what's the broad impact physical therapy has not only on their shoulder pain or their back pain, but their whole life, really. But when I get in conversations with PTs, we talk a lot about what we've touched on previously is an innovative way to doing PT where a patient has fast access to me regardless of geography,
right,
schedule, and we're really going about overcoming the traditional burdens of physical therapy access. And so if we broadly define those, we would say cost, major burden, geography and schedule, a major burden. And we see some of this pushback. I mean, in startups, one of the things that I focus on is being open when people are available. That means, between the hours of 9 and 5, people have jobs and they're going to have to take PTO to get out of, being at work to take care of whatever they've got going on. So I need to be open outside of those hours to make it as easy as possible. Well, with MoviHealth, when we have a virtual environment, somebody doesn't even need to leave their job. They can take a call on lunch or on a 10-minute break, or a mom that's just given birth. We know how important physical therapy care is postpartum. Putting a baby down for a nap. In fact, my 2-year-old's napping right now. I can take a podcast recording. I can take a physical therapy call and not leave the house and not burden my schedule by doing that. And those are things that we don't inherently think of as PTs, because we think of what happens in our clinic and how those patients are in our clinic. And we get so narrowly focused on. Geography is huge. What if somebody had to travel even 45 minutes to get you? That's an hour and a half of travel time.
Just in travel time.
And so the virtual environment provides an opportunity to do that, to overcome those burdens. But we know that it's not sufficient in isolation. Not only that, but we know that patients actually prefer to be in clinic sometimes, and a lot of times. And so we don't want to remove that burden. In fact, we got to that crossroads where we were deciding whether we were going to do all virtual initial evaluations or if we were going to allow somebody to go into the clinic. And we're so focused on making sure that the patient be the driver of their healthcare is that we remove that burden, allow the patient to decide if they want to get into the clinic. Let's let them get into the clinic for their first evaluation. We're not going to let them do that without understanding they can have faster access by going virtually. But it really is about relieving those burdens of care. Cost is another one. So within MoviHealth, what we do is we contract with employers to offer this as a benefit. And so this is offered at a benefit at the cost to the employee. So there's no out-of-pocket cost. It's another huge burden to seeing physical therapy care. That was one thing that I saw in Walmart glaringly. I don't think anybody in the claims-based space is missing that. But in Walmart in particular, where you're talking about an employee that's making $11, $12 an hour and has a $75 copay, a $75 copay per visit, what it does is it expedites care into those less conservative, lower valuable channels because it becomes less expensive, right?
Right.
At some point, when you're talking $150 a visit, people aren't choosing between physical therapy and seeing the ortho. They're choosing between physical therapy and dinner. And that was a recollection that really hit me upside the head pretty hard. In just understanding that side of the fence. Like it's not just about not going to orthopedic surgeon or not going to, urgent care. It might be about dinner or, feeding kids or feeding yourself. So that's another huge burden that we overcome by directly contracting with employers.
Now, we've spoken a few times, but I don't know you too well. But what I have taken away is you're a pretty optimistic guy. I don't know if you have to be optimistic to be an innovation, but I'm pretty sure it helps. And you're optimistic really about the future of healthcare, or else you wouldn't be doing what you're doing, and physical therapy, that nice crossroads. So even at a time when many are feeling uncertain, I feel like I'm getting optimism from you. So, but what gives you hope? And what role do you see PTs playing in the broader healthcare landscape moving forward? I feel like MoviHealth is a great way of saying, hey, geography, if we could remove the pain of geography and speed and time, which sounds like something crazy. If we had said that 15 years ago, I'm going to bend time. We're going to remove time from the equation. How are you going to do that? But we've shown necessity is the mother of invention, that if we had to do that, we could. So in a role like yours with innovation, what are you excited about in terms of the future?
Yeah, PT in particular. So I'll focus in on PT because I don't think that there's a more exciting time to be in physical therapy. And, I think Larry does a really good job of this. Amongst some of the challenges that face us, it really is the best time to be in PT. And necessity breeds innovation. Well, that's happening on the broader healthcare space. And another, real focus of Movi is cost savings, not only to the employer or to the patient, but to the health plan as well. And we know PT is where that happens. And I remember specifically having a conversation when I was taking the role at Walmart Health was, we don't have to go do anything different than what we do to be effective. So if PTs are only accessed 10% of what they need to be, we have a 90% upside. We don't have to cut anything out. We just have to go reach more people, which has its challenges. That's not easy, but what a time to be alive. Are you kidding me? What a time to be a physical therapist. We get to go be effective by being what we are because controls or costs have gotten so out of sorts, right? So where other people might have to cut out their intervention, the healthcare system's looking to us to step up. We've got to step up and take the opportunity to recognize our value in cost, recognize our value in life. Like people are better when they've seen a physical therapist. I'm certainly the beneficiary of that, having a mom who's a PT, right? Like, yeah, it's easy for me to see. So I think it's easy to be optimistic. And when I find myself pessimistic, I start to look at what am I consuming? What am I looking at? And I get, yeah, exactly right. Turn in the wheel and narrow. And so if I can zoom out of that and recognize where we are as a profession, how far we've come. You can, is it 2 states, I think now, that have some kind of restriction on direct access beyond the first visit, but 48 states you can walk in and be treated. Now, there's some changes based on state, but
I remember, I graduated in 2016 and the number was definitely, it was like 10 or 12. And it was like, I remember looking at the map they used to put online and it'd be like, well, eventually we'll get there. And people being like, I'll never get there. And it wasn't overnight, but someone had to keep pushing that and be optimistic about it. Now it's 2024 and we're at, 48, as you mentioned. You've,
21 are unrestricted. 20
right.
or 20 are unrestricted, right? You can see them as long as you want. Super cool.
It's a good time to be a physical therapist, which is good because this is the only time you have a choice. This is the only time there's an option. You can say you wanted to go back to the good old days and it would be nice, but you can't. So you might as well be optimistic at what you have now.
Well, and I think if we went back there and really looked at the landscape there, it would be a different conversation maybe, but a lot of the same problems and even more challenging problems, right? We're not where we are today because we haven't overcome anything.
Sure.
And so there's ton that's been overcome. And in that, there's a ton of opportunity, which is super exciting.
Yep. Now, you've mentioned that your success in your career, personally, professionally, often comes down to saying yes. Can you share a time when taking a leap of faith paid off for you professionally? What'd that look like?
Yes, there's a couple of times, and maybe that's not surprising given, the things we've already talked about here. But, think about the first, really the second job I took. So I took a job right out of PT school at a small clinic called Core Physical Therapy in Bon Air, Georgia. Fantastic first job. I couldn't have been in a better place for my first job to be nurtured in a clinical environment, have coworkers that really cared about me as a new grad and clinically supported me. But very quickly, I knew that I needed, sort of the next step. So my wife is a PT as well. I guess unsurprising, my mom, my wife. And so she was graduating. It was time to look for somewhere to go together where we were going to have a job together. We were dating and engaged at the time, but not married. So we were going to get married and we needed to go find a job. And we had a connection to John Childs through my wife's brother-in-law. And so I interviewed him. I'll never forget it. He took the call coming home from the lake with his family, which I was just beside myself that he would take his personal time to talk to me. Anyway, they offered me the job. So I talked to John Childs on the phone. I'm going to San Antonio, Texas. The only time I had been in San Antonio, Texas was a layover to my honeymoon in Hawaii. So I didn't know who these guys were.
Yeah.
I had never been to Texas, and we loaded up a U-Haul and drove to Texas with no place to live. So said yes and landed us there. Can't say enough good things about my time at Tex PTS and what I learned and the opportunities that I was given through mentorship and through just the immense opportunities that, Tex PTS and Confluent Health just provided in leadership training. And really the next step was always super easy because it was right there. I just had to say yes and go do it, which then led me to the Walmart Health opportunity. So COVID hit, Georgia's home, Texas is where I was. But there was this opportunity that popped up in Noonan, Georgia. And Noonan's where my PT school roommate lives. 2 of my wife's classmates are there. My wife was looking to get back home. We had some health challenges in our family. And we've got 2 kids now. We want them to be around their grandparents. So, hey, maybe there's an opportunity here. So I talked to the recruiter. Like, man, Walmart? I just don't know about Walmart. The next day, Bridget Finley gets on the phone and calls me, we really need you to do this. And so I said, Danielle, I think we got to do this. I think we got to do it. And they said, so took the job and she said, great, we need you there in 6 weeks. So with a 3-year-old and a 1-year-old, we sold our house in 2 days. We flew to Georgia to find a house. We got put in an offer and got the house that we live in now. Literally loaded up a U-Haul with 2 kids and moved back to Georgia, waiting to close on our house. So we kind of homeless in the interim. So yeah. I lived with my PT school roommate and his family. I stayed on, they had a spare bedroom. So it's not like the days of PT school where you lay on the couch, but they were super gracious to take me in. My family stayed with family until we were able to close on our house. But just again, it was just an intuition and opportunity to say yes. And then again, with Movi came up is really exciting opportunity. Things with Walmart they were going, but at a snail's pace, and we kind of saw the writing on the wall that's come full circle now. We understand, what happened with Walmart, but again, like, oh man, I don't know virtual care, but it's exciting and it's new and it's different and it's an opportunity. So I think I should do it. And just went for it. And so that's paid dividends, but obviously not outside of, developing relationships and knowing people and making sure that, what builds me is the people that I'm with and the people that I'm working with on a daily basis. So the exciting part now is that, 3 of the clinicians that I work with every day on the virtual team, we're all connected back to being a new grad, like 1 year in residency at Tex PTS. So one I worked directly with in residency, one I actually hired to work in my clinic. And then our other one, Linda, was in Austin area, but was brought up in sort of the Tex PTS residency. So it was really full circle. We kind of all went our different ways and then came back and landed on the same team. Not by any doing of my own. We just all landed back in the same spot, right? I didn't rehire them. They had just developed their expertise in an area that was back intersecting with my expertise. So it's been a ton of fun to see how, faithful steps have resulted in where I'm at today.
Looks like just like a road full of yeses. It is key though.
Just yes.
Saying yes to everything. Yes, Man, that movie did highlight where saying yes to everything can get you in trouble. But really it's understanding what might drive the yes.
That's exactly right.
So understanding like, this is a good opportunity to say yes, but also, I'm guilty of this as well, which is understanding what to say no to. Because if you say yes to something for the reason to say yes, you actually are saying no to something else that might be a better opportunity. So, and this is the worst part is I have to say that my PT school professors knew what they were talking about when it was like time to be self-reflective. And I didn't want to do this much reflection in PT school. And then the more you actually do it in big opportunities, that's where the answer is. The answer isn't Google. It's not AI. The answer might be talking to someone else. But if they just ask good questions, you're going to talk yourself into or out of the thing that you knew was right all along.
Yeah. And every opportunity to say yes really has been more than just a narrow view, right? It's not just my career. Like the first one was an opportunity for me and my wife to move away from family and sort of chart our own territory. So we talk about this, work-life balance. I think it was Daphne Scott that taught more of a work-life harmonization, right? Like I'm not a different person at work than I am at home. And so making decisions, for your career in light of your personal situation is super important. And every step that we have taken has been both helpful for, my career, but that was the biggest thing at risk. We were, personally, they were good moves for me and my family, and the career was the add-on, and has been absolutely helpful. And I wouldn't change anything, any step along the way. So don't say yes for nothing. Make sure that you're saying yes to the right things for sure. And introspection's huge. It's got to align. If I went into something where I had to, be quiet and get in line, it probably wouldn't go so well for me, right? I wouldn't be where I needed to be. So,
last thing we do on each episode is the parting shot. It's your chance. You can repeat something you said before, or something like, "Oh, yeah, that's a new idea," or a soapbox statement. A lot of people in education usually have their typical soapboxes. What's your parting shot?
Yeah, you don't have 3 hours for a soapbox, so I'll leave you with a parting shot.
Perfect.
See challenges as an opportunity.
Yeah, love that. Stephen Clark, Clinical Innovations Director at Confluent Health. Appreciate your time, man.
Yeah, thanks for having me.
The PT Pintcast is a product of PT Pintcast LLC. It is hosted and produced by PT Pintcast CEO Jim McKay and CBO Sky Donovan from Marymount University. We talk PT, drink beer, and record it. This has been another pour from the PT Pintcast. The PT Pintcast is intended for educational purposes only. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present. More on the show at ptpintcast.com.
Today's episode brought to you by Owens Recovery Science, a single source for PTs who want to add personalized blood flow restriction rehabilitation training to their clinical practice. Get certified at owensrecoveryscience.com. the all-in-one outpatient PT EMR built on automation. That's Empower EMR. They empower owners, physical therapists, billers, and your front desk to profitably provide the best possible patient care experience. Find them online at empoweremr.com. That is empoweremr.com.